Hi there, Dr. David here. I want to talk a little bit about brain energy and what we're finding out, both from research and also from in our own private practice, seeing clients and patients around the world. Now, initially, when I started treating people with dementia, the focus was on primarily on just repairing the damage, right? So the loss of brain cells, what can we do to help the brain repair the damaged brain cells, but also reproduce new brain cells? Yes, the brain does produce new brain cells, not as effectively as you would as a child when you were a child, but for sure, there are certain parts of the brain that are constantly producing new brain cells every single day. That's another discussion for another day. But bottom line was that was our target and our focus. But later on, I began to find out that even more important than that is the topic or the subject of brain energy. And what the research is saying is that for decades before the first symptoms, decades, 20, 30, even 40 years, that there's a drop in brain metabolism. In other words, the brain is not neurons are not first, they're not able to produce enough ATP, which is the currency of energy, and they're not even able to use that ATP, use that ATP like they should. So there's a decline in the production of energy. That is now what forms the basis for the myriad of things, everything from depression, mental health conditions, to neurological or neurodegenerative conditions, such as Parkinson's disease, even strokes, and of course, dementia of all forms, about 100 different kinds of dementia. Alzheimer's disease is just one. And so the real question should be, what should we be doing to improve or to maintain the brain's ability to metabolize or to produce energy on a constant day-to-day basis? We cannot leave that in the doctor's hands, or we cannot leave that to just drugs. We must find out what patients and the clients are doing that is, shall we say, sabotaging or compromising their ability to produce brain energy, and then teach them what they need to do to enhance brain energy. And as you know, I'm a big proponent of specific targeted nutrients to address different conditions in the brain. And so I've been doing a lot of looking into about how to improve brain energy. Now, let me just go back a little bit. So if your brain is not producing enough energy, a lot of things that can go wrong. I'm just going to mention a few of them. One, obviously, in those connections, synapses, synaptic function will be compromised. Those, the ability to pass signals from one cell to the other will be compromised. Two, the ability to repair damaged brain cells will be compromised. Number three, the ability of the brain to remove toxic substances, including excess amyloid plaque, will be compromised as well. And so that's part of what causes the buildup in these plaques that have been known or been associated with Alzheimer's disease. So again, we need to go back to the basics, which is energy production in the brain. And it's as you can imagine, it's a lot more complicated than I'm making it sound, but just starting off, investigating, turning our attention to it can certainly help in making this happen. So follow us for more information. I will probably be dropping more information about brain health and dementia, and where the role energy plays in it as we go along. So catch you later. Be sure to subscribe and like this video. Bye.